And do you have any videos?
No, just slides. Right. We do have one other presenter that we're trying to get a hold of. But
Okay. All right, I will check back in a bit. Make sure we have something. That's right. And do you have your slides open now? Or?
yeah, it's like, do you want me to put them up or?
Sure. All right, thanks, Six.
Bro, really gonna grill me.
There was nobody in the front that you would do this teacher presentation.
I've seen few friendly faces.
That power.
I actually added a white line to our template, but I didn't like the way it looked.
I actually do like it. It's like, I'm pretty sure I haven't been in here like a double.
Yeah,
Is that a template?
Well, the template without the white line, so you can see the photos behind the orange, like happy orange.
Did you add them?
Oh, maybe I changed the grade. I
I'm
don't,
guessing.
Started with the template.
yeah, I started with the layout and then. I didn't
I
appreciate it, how it looks.
I used a template. I started with the template on mine too, and then chose the two slides that I like the best and use those for everything.
Yeah, it's kind of.
Yeah, I did that for the like workshop videos, but then I switched out every single one of the pictures, other pictures. And I'm gonna do all wash.
No, Abraham.
I'm trying to look around.
I mean, I'm-
Oh my gosh.
I know,
That's so much sushi.
How was the, they say you went with the fence.
We just kind of like, actually heard their house and then. Actually saw their house and then I just. A little baby, golden retriever, but it's like 4 months old, so like. I can't do the mask, it's proper massive, it's like. How big is it? Just like
Yeah, those are,
baby birds, those. Those are cute, and we just go over like a park, and they apparently take a. Very rolling, like food tracks and like live music and it's good. So they just there, like, you know, hands there, like all of them, they're calling, they just showed up and like. Guess we'll take pictures. So, hello. Really, Mike.
Hey, everyone, how are you? I'm good. Hey, we have the UNC session on water and energy this morning. Are you able to log in?
And then.
Yes, is now.
Yeah, we drove over there. You can't put some plates back there. Anderson.
Okay, is it, you're okay? All right, okay, great. All right, thank you, Abraham. All right. Bye.
Time on.
Day roll, is it
Okay.
today?
Thank you.
Morning. Was it good?
Yeah. Yeah, just we didn't ever know. Okay.
Really good. We should have their wedding. I was the one in Detroit. So they're like.
That's really fun.
She's the one. That, like my friends after taking the content with, I don't know.
Right, so we've been doing it since like 60 years.
So we're not. Being in this space. We understand.
It started, yeah, whoever walked in. Thank you. Do you need me to do anything else with the webinar? We're good. I'm trying to buy time.
How do you know when he logs in?
I can see it
Oh.
here. We're waiting on one other convener. But I'm gonna give him one more minute and then we'll get started and hopefully he joins.
Minutes, chance to get more snack.
Yeah. Is this weird?
Yeah.
Oh, it's just,
Yeah.
yeah, to do this the whole time? I guess I need to talk louder.
Is there anybody online?
Yeah, everyone but the. Oh, you mean participants?
Yeah.
We'll see. Still waking up. All right, why don't we get started? Because we're gonna start with some introductions. And so hopefully our convener, Abraham from the Children's Investment Fund Foundation will join in the next few minutes. But first of all, thank you so much for sticking it out Friday, for joining me for one of the final sessions on WASH and energy. So we are going to focus on the integration of WASH and energy, and we'll kind of talk more about that and showcase some case studies around that topic. But we also want this to be more of a systems integration, systems thinking talk as well. And how can we better be integrating and layering systems to provide more impact with our solutions? So we do have some virtual conveners. Unfortunately, you're stuck with me in person, but we have some great speakers here. And so I'm going to go through a quick agenda and then we're going to go through a quick agenda eventually. Okay, and then we'll get to hear from our speakers, who they are, and a little bit of background. So I'll start with after the intros, I'll start with a quick overview just to set the stage. Sorry if you can't hear me. On what we're thinking about the integration of WASH and energy, why it's important, and some of the opportunities and maybe some of the challenges. And then as we move in, each of our conveners will have about 5 to 10 minutes or so to give a little overview of what they've been working on related to this topic. Following that, we thought we'd pause for maybe 20 minutes or so and open it up for Q&A. Hopefully you are thinking about those questions during their presentations, jot them down. And then after that, we've as a group kind of come up with some key questions we think are important to continue this discussion moving forward. And so get your phones ready. We have some QR codes that hopefully link to the right questions. And we'll kind of see some of your responses about how we can integrate this more into the future. So let's start with some introductions. I'm just going to check and see if Abraham is not here yet. So I didn't introduce myself yet, but I'm Adam Questad, a senior WASH engineer with World Vision. And my focus is on engineering quality control, and also very interested in how we can better integrate systems in WASH and energy. And I'm going to pull our conveners over here. Get ready, conveners. I don't know if I can make that bigger. Okay, bear with me, everyone. Add the innovations there too. All right. Here we go. Sonika, do you want to introduce yourself for the audience, please?
Sure. My name is, right now is written as Pravashika Khattri. It's my legal name. I go by my name Monica. I work with Bechtel. I've been a part of Bechtel for 6 years, mainly focusing on civil construction. That's my background and degree. I now work with Bechtel.org, which is the social enterprise branch of Bechtel, working in developing and vulnerable communities to help make them more resilient and sustainable. So good morning, everyone, and welcome, and very happy to be here. All right.
Great,
I'll pass it back to you, Adam. Yes.
Yeah, thanks, Sonika. Fatu. Would you introduce yourself, please?
Good morning, everyone, and good afternoon from this side. I'm Fatu Yunkela, and I'm the CEO for Dalan Development Consultants. Dalan is a local consulting agency in Sierra Leone, and for this particular audience, we are a local partner of the Health Grid Project in Sierra Leone. And my background is in public health and monitoring and evaluation. And some of my monitoring and evaluation kind of exposure I gained at UNC. I have other connections with UNC, and so I'm happy to be part of this audience. Thank you.
Thank you, Fatu. And Mason.
Hi, folks. Good to be here. My name is Mason Hines. I am a mediator with an organization called Resolve. Resolve is a NGO based in DC. We do a lot of different things across a lot of different topic areas, but the general gist is sort of creating innovative partnerships to solve complex problems. I work primarily in our what we call Healthy Communities portfolio, which focuses on issues of healthcare, public health, and all things related to health. And Resolve serves as the lead for Health Grid Sierra Leone, the program that Fatu was just talking about, and that we're going to talk about a little bit more later.
Great, thank you, Mason. Thank you, everyone. We do have some virtual participants, so thank you all for joining us. If you have questions as we go through this, please enter them into the Q&A, and we'll definitely get those addressed later on. So we do have one other convener, who's Abraham Asmari from the Children's Investment Fund Foundation. He is trying to log in, so hopefully he will be able to join us, but we'll have to give his intro later on if he's able to do that. So Mason and Fatu, just a heads up, we're going to have you go first instead of Abraham. So I'm going to pull this away for a second. Now it's giant on my screen. All right, so like I said, I'm going to start off just kind of setting the stage for why we think it's important, why we're here today, and then we'll jump into our conveners and talking about the case studies, which World Vision has been involved in with both Resolve and as well, oh, sorry about that, with Children's Investment Fund Foundation, which is CIF, which I will now say CIF from now on. So I'm going to start off with something that's unrelated to WASH. Work. Sorry. There we go. Anyone know what this is? Nobody? No engineers?
It looks like a retention basin.
Yes, it's a retention basin. Why are we talking about a retention basin? I thought it would be interesting, and it'll make a little more sense later, but maybe this is way off and I'm just an engineer and this is interesting to me, and so we'll see. But this is a retention basin. The purpose is when you have extreme flooding, you're trying to provide volume, peak attenuation is what we call it in the hydrology world. So the water comes in. If you don't have this, it just goes, floods people's houses. You put this volume in and the water can go somewhere and it's not going to flood. So that's the engineering part of it. But you could design this many different ways, right? So you could design it like this. How does that look to everyone? Maybe engineering wise, you have some good volume. Number one, that's a huge safety concern. There's no fence and someone could fall into that. But number two, it's pretty ugly. And if I lived nearby, I might not want to walk by that on a daily basis. So you could design it like this. Anyone recognize this? Rain garden next to the courtyard. And I walked over. I put these together this morning because I saw this and was like, yes. So the whole idea is this is systems thinking. How do we layer systems while we're providing solutions? So you could just put in a big bathtub, right? Or you could put in a bathtub that looks nice, provides a good human experience, and also has ecosystem benefits. So that's what, a lot of people are working on that. That's why they've done this, and it makes sense. But that's kind of the concept that we're talking about today in a totally different context. And we have, more important health outcomes that we're talking about. But I also thought it was fun to talk about engineering. So that was good. So why is it important? Now we switch back to WASH and energy. Why is it important that we discuss this? And later you'll have an opportunity to answer that question and kind of give us your feedback on that. But why do we think it's important? I'm going to walk through a few slides that collectively kind of build evidence for why this is important. So bear with me. So first off, electricity access in sub-Saharan Africa is lacking. So in 2020, 48% of populations had access to electricity. What makes this even more severe is that only 29% of rural populations had access. And I think it's a little crazy. Back in 2000, it was around 15, 16, 17. So we haven't made significant progress. And I know there's other SDGs that we're working on as well, but I think this one is one that often gets overlooked, especially in the WASH conversations. So why is that important? Well, this is another statistic about healthcare facilities in a study done in 2018. Over 121,000 facilities, only 40% had access to electricity. So if you imagine going to a healthcare facility, a hospital without electricity, you can imagine how that might feel in terms of the healthcare and the service that you're being provided. Third, solar energy is being used more and more for water pumping. So at the WASH is how we bring it back to the WASH sector. As you'll see in the next slide, and I can't say it yet because I don't want to tee it up, but we're using solar more and more. And you can see from here, these are some estimates that World Vision has done for different facilities. Depending on the size of the facility and the power demands, water pumping can make up a pretty significant portion of that demand. So the idea here is, well, if you're already providing 50% of the demand, it's more efficient, it's more cost effective to provide 100% at the same time versus trying to fill that extra 50% or so. Later, somebody else, separate system is way more inefficient. We'll touch on that later. So why is solar being used more and more? Solar energy is getting cheaper. So these are just two examples of some studies that have been done to show the cost of solar over time. And it's pretty dramatic. You can see that it's almost the cheapest, if I shouldn't need to use this, the $50 right there is almost the cheapest cost of energy in our current day, although that's 2017. So because of that, it's opening up new opportunities for use of energy for water pumping, but we think also expanding that into new opportunities as well. And then finally, we think there are a lot of efficiencies to integrating these two together. So we kind of touched on these a little bit, but there are opportunities for shared costs. So when you're mobilizing construction crews or design, and you're doing that for a specific service like water, 20 to 30% of that could be shared if you're also implementing electricity or other systems as well. So there's opportunity for cost savings. In addition, though, we think there are other opportunities to shared maintenance and management. It's a lot easier if you have one management structure working with local governments to get that established versus having separate actors who's we're not sure who's responsible for what. And finally, the willingness to pay. There are some studies, and I don't have them up here, but some studies have shown that people are more willing to pay for electricity in some areas where they think water should be free or is a public right. And because of that, it offers revenue streams for maintaining both systems, for water and for electricity. So that as well. So for World Vision specifically, we are working in 40 plus countries. And as you see over here, over half, and I think that's going to continue to grow, of our systems are powered by solar. So we as an organization, because of everything we just talked about, feel like we have an opportunity to leverage our programming to provide expanded health outcomes. And so that's why we're here to talk about this today. And I'm gonna hand it over to Fatu and Mason to touch on the Health Grid project, which World Vision is also partnering on. And then hopefully after that, we'll have Abraham join us. So Mason and Fatu, I'm gonna pull your slides up and then I'm gonna hand it over to you. I really should have recruited somebody to help me with all the technical things here. Yes. Sorry, everyone. All right. So let's talk about some case studies now. Mason and Fatu, I'm not going to show your faces yet, just so you can have full access to the slides, but let me know when you want me to advance, okay?
Should I start? Yeah. So Mason and I are co-presenters. I'll start off with the presentation, and Mason would support me with further clarification and especially in the Q&A session. Next slide. We just want to run through just looking at the problem and need, some of which has been touched on by Adam, and then looking at what does the methodology of the Health Grid project that we're involved with, what does it look like, and then what we hope to achieve as a result of implementation of this Health Grid project. Again, I think everyone is would agree that we need power, reliable power, to be able to sort of pump water to key points of care, and many of our health facilities, or has been shown by the statistics from Adam, may be constrained in doing this. Next slide. Again, more statistics from some reliable sources about even though sub-Saharan Africa makes up 75% of the world's population, or rather world population without electricity. When you look at the proportion without electricity, the maximum, us living in sub-Saharan Africa contribute 75%. And about a third of healthcare facilities in sub-Saharan Africa have access to reliable facility. If you drill down to Sierra Leone, only 2% of the facilities in health in Sierra Leone are connected to some mini grid to obtain reliable energy or electricity. So the problem is glaring, especially when you drill down to the situation in Sierra Leone. Next slide.
Sorry, one second.
Right. And another issue is even where some health facilities may have say access to energy and wash facilities integrated, often the problem is always with the operations and maintenance. A lot of investment would go to the installation and the like, but the operations and maintenance is always a problem. And that is what kind of limits the longevity of the investments that are made. So now that we've looked at the problem in terms of accessibility, in terms of operations and maintenance, these are the two key issues that the project that we are involved with is trying to kind of do a pilot to find out how we can address these issues. So Health Grid is funded by USAID under its Global Development Alliance, under the Resolve Consortium. Resolve project. Resolve is leading the consortium, and the partners are listed, including World Vision, Orange Sierra Leone, and other partners. And the general aim is to provide electricity and internet connectivity and wash systems for off-grid healthcare facilities in Sierra Leone, facilities that are really in rural areas and don't have reliable electricity that are off-grid. So the fundamental goal, of course, is to have the equipment installed and to make sure that they are functional over a long time. So part of the project design is to ensure an innovative public-private partnership in order to sustain the operations and maintenance design. Next slide. So I'll just give you a quick overview of the approach using a pictorial slide. Two pictorial slides. This is the simplest. The project, as you could see, the interventions are first get an energy through solar panels installed in these health facilities. And with the solar panels that would drive or facilitate internet connectivity within these facilities, and selected facilities would also have access to water. And all these are aimed at building or building capacity for about 31 off-grid facilities in Sierra Leone, spread within about 10 districts, very rural districts. In the next slide, yes, we would try to sort of explain the approach, the model itself. So maybe I'll start with the cell in which we have the health facility. The health facility is where is the target intervention site with the three potential interventions, at least the two core ones, because only selected sites would facilities would have the water. And then we move on to what we're calling the kiosk. The kiosk is the attempt to be able to, knowing that the facility, once the solar panels are installed,
Fatu's breaking up here. Maybe I can jump in. Are you guys seeing her frozen as well?
Yes.
Okay.
Yeah. Go ahead, Mason, until she comes
So
back.
the moving to the second square here with the kiosk, the solar power.
generated.
Oh, she's back.
Am I coming through? Excess energy would be generated.
Okay.
We've just gotten some power cuts, so I don't know. Are you getting me?
You're back now, yeah.
Very ironic. They're having hours.
Well, I mean, we're talking about energy, so. Right, yes, so the chaos idea is.
20 seconds if you want to back up just a little bit and then keep going.
Okay, so maybe I'll just back up a little bit, starting with the health facility. The health facility is the target intervention site, where we're aiming to install off-grid or solar panels to generate energy that would automatically also facilitate the having internet connectivity. Some of the facilities, based on the funding and everything, would have water, so that the energy could also be used to pump water. But the energy that will be generated, it's very likely, we know, would have excess energy. And so that would be sort of through the kiosk system, the excess would be made available to nearby communities so that they can also, either, like charge mobile phones for minimum amounts, support entrepreneur entities within the community. And based on that, there will be some funding generated that will be directed towards the operation and maintenance. And that the funding will be maintained within the sustainability fund. Obviously, we reckon that the fund to be generated will have to be augmented, by other donors and the government to make sure that there is adequate funding for operations and maintenance. So if we move on to the left-hand side of what we're trying to demonstrate here is that there'll be cloud-based monitoring, not only to look at the energy aspect, to what extent has it been sort of sustainable throughout the project period, but also the operations and maintenance model. So there will be cloud-based monitoring, and then we will be disseminating information to our partners, including the Ministry of Health, which is a key partner, USAID donor, other Health Grid Alliance, and the kiosk participants. So we know exactly what's been going on. So roughly, this is the model that we're hoping to be able to communicate about at the end of the day about what have been the benefits and what are the lessons learned.
Fatu,
The final slide.
Can I just jump in, Fatu, for 1 second? And just
Yes. Yes.
The one other thing I just wanted to highlight here is just another important part, or another important public-private partnership that's part of Health Grid Sierra Leone. And that's that top box that says mobile network operator. And one of the key partners in Health Grid Sierra Leone is Orange Sierra Leone. Orange is a major mobile network operator. And they are the company, the organization that's actually going to facilitate the O&M service provision. So they may not be providing the service themselves, but they'll sort of be like the hotline that health facilities or whoever is kind of doing the first level of maintenance on the equipment can call to kind of rustle up a service provider or someone to do maintenance. And so they're the ones who, from the sustainability fund, we would divert, or we would direct funding to them to supply that first level in operations and maintenance. And Orange is also the one providing the internet connectivity to the health facilities. And so they have a vested interest in making sure, of course, that the power works, because that's what's powering their mobile connections or their Wi-Fi hotspots in the community. And so I just wanted to highlight that additional piece of the model here.
Sorry, we're having some power issues. Thank you, Mason, for that good addition. So he covered the four. And so the last slide.
1 second.
So what do we hope to achieve with the model once we get going with enhancing the 31 or so facilities? Of course, the obvious would be there would be reduced power and water shortages at these facilities, and we know many of us can figure out how that had been impacting on quality of care, especially the water, in terms of infection prevention control, the power. We know, the equipments that have been managed by the facilities that are dependent on power. So we want to make, this would make sure that there is continuity to reduce or improve quality of care. I mentioned spread of infection that would be significantly reduced with adequate flow of water, and then the internet that will be installed would also be very useful for data management, and also to share health information, not only to the district level, but also to the central level. And then just generally, when we improve the overall working environment for the healthcare providers, that would also improve the conditions for healthcare providers in terms of the work setting. So these are just sort of generally what we want to be able to track when we look at our M&E model that we are currently working with World Vision to put in place so that we can come back and demonstrate to what extent have we achieved these. So in short, I know we had 5 to 10 minutes. This is what the Health Grid project is all about. And the partnership in the next slide, you can see is very all encompassing, very Mason mentioned, public-private, and you could see all the partners that are involved in the project. So, I mean, Mason, if you want to add anything else before we hand over to Adam.
No, I don't think you think so. Thank you.
Right.
So thank you, Adam.
Yeah, thank you both very much. Good job. So save your questions. I know you have thousands. We're going to go over to Sonica from Bechtel.org. And then hopefully Abraham at the end. So Sonica, 1 second.
He joined it.
He hasn't joined yet. All right, so now we're going to shift Sonica's, she can tell you, but we're going to kind of shift to a more systems thinking, systems integration discussion for a little bit. All right, take it away, Sonica.
All right. Thanks, everyone. So the example at Health Grid that Fatu and Mason gave, we're going to kind of touch on the same points where the partnership was very key, and working with the government, nonprofits, private sector, investors, all was key when it came to our systems thinking approach. When you think of systems approach, one just thinks of the design aspect, but there's so many people that need to be involved, even with the design aspect, to be successful in the end. So what we have on the screen is our systems thinking approach. I like to start backwards, going into social impact first. What is our end result? What are we trying to accomplish and achieve? What legacy do we want to leave behind in the community? How do we want to empower them? And what knowledge especially can we leave behind to make sure that they're going to stay resilient and sustainable in the long run? And what I've noticed is, at least in the States, sometimes there's a 1-for-1 correlation. When I have one problem, I'm going to come up with this one solution to solve this one problem. But we need to be more dynamic than that. We have to have a multiple use and a multiple solution approach when it comes to social impact. And our systems integrated thinking is the innovation at the end that we would like to leave behind as the legacy in the community. So Bechtel.org, you'll see on the next slide, we co-ideate all of our projects. This gives us the ability to stay holistic and look at the bigger picture before going into the complex systems. When it starts with, what do we want to leave behind? So that's social impact. And then when you work your way backwards with the project outcomes, project outputs, the project development and delivery, those are our stakeholders. Who's going to come along with this journey with us? Is there a certain portion that they're going to be able to buy into or even own at the end of the day? And how do we get this to scale? Because they're going to be our partners with us to get this impact to as many people as possible in the community. And that is our impact thinking. So that's my way of explaining integrated systems approach. We really work backwards with the end goal in mind, having multiple systems tied into one and impacting as many people as possible, which implies we're going to have many partners. Next slide, please. Okay, so we have a couple of case studies. So the case studies I'm going to run you by are actually in the prototype to pilot phase, and some are in the pilot to scale phase. So the first one that we're going to talk about is a health sector crisis where we utilized solar energy. So in Peru, there's a lot of children and elderly that were dying of respiratory illnesses that live in the high Andes Mountains of Peru. Engineer designed, we worked with the local school institute, the university there, to actually come up with a solar harvesting system that will be integrated into the home. The homes aren't well insulated and there's not enough warmth there. So this solar energy that we're harvesting is going to be heating the homes throughout the night so they could have a sustainable living temperature. That is ironically the easy part, is the design and coming up with the easy design to work for the community. The challenge actually in this project in particular was the stakeholders that were going to be involved. We actually worked with the Ministry of Housing in Peru, and we're on our way of getting endorsement for this design to be applicable to every home. So in this systems integrated approach, it's not just the design that we're integrating solar into the home, but the stakeholders involved as well with the government to be able to use this design at scale for more housing. And the other, I would say, hurdle that we had to go through was there was actually a change in government at the time too. So not only did we have to persuade our government initially when the project had started, but when the government had shifted, we had to do the same persuasion and work with them. And they also saw the vision that we had too and the mission that we had, and they wanted to work with us to be able to now scale this project. We're just working on the prototype and refining the design and still working on that next phase. But that also gets you thinking, we have solar accessibility in a very high rural area in the Andes. What else can we do? So if we were to just think out loud, what else can we do to utilize solar? Some thoughts that came to my mind, and I'm open to ideas on the floor at the end too, with some thoughts that came to my mind were, how can we utilize the extra solar energy? Perhaps we could also start, instead of just housing, but having more of a sustainable village community with more businesses available, because we could heat up more houses and more businesses. That will increase the either tourism or economy in the area. Perhaps we can use a pump, as well as Adam mentioned earlier, since it's in a high altitude area. Granted, it's in colder conditions and we'll need to really insulate the pipe, but how do you get water from a rural area that high up? Those are the potential questions that we could potentially expand to with the system already in place, which is that solar system. So that was a variable that I thought of afterwards, actually creating the slide, was how do they currently fetch water? How can we get water into their homes with understanding the cold climate conditions? We would have to insulate the pipe in a way that it would be sustainable. So that was one example of health sector and systems thinking. The next one is actually based in India. We came up with the nature-based systems, which integrated green and gray infrastructure. And as a result of working with green-gray infrastructure, we were able to purify the water to a non-potable state, so it'd be used for secondary uses rather than primary uses as potable. But we were able to filter water enough to a state that it will be placed in the canal, and the canal can now operate as it's supposed to and mitigate flooding. So like I said, this is in the prototype pilot phase. The biggest challenge actually with this project is we spoke with the mayor and they really like this idea, but there's not much data out there for nature-based solutions or nature-based systems. But the beauty of this is it's integrating wastewater, it's integrating flood mitigation, it's regenerating the biodiversity in the area because we're purifying the water. It has so many aspects and elements to it, and the government mayor loves the idea, but there is the case that there's not enough evidence. This was just a design. With that being said, I think that makes us more determined to have a duty to actually conduct this case study, because then we'll have data and knowledge available for future projects as well. So with this nature-based systems in mind, the other element, thinking out loud, not just the green, gray, and blue, which is elements on its own, we could even make digitalization a part of the integrated systems thinking. We could put control points amongst the canal and have those control points either monitor water elevation or turbidity in the water itself to see, is this system actually working? Is the water still remaining clean as intended per design? So that's the other layer, I would say, of systems integrated thinking, to make things digital, to make it easier for the community to monitor, but also to validate any data points or data sets that we're conducting with this pilot. So with that being said, I could go on and on more about the many variables to the systems design, but just to conclude, we would like to see how can we impact things to scale, which nonprofits or private sectors or partnerships can we make to get us to this innovative end state, and how can we get this to scale to maximize all of that impact. So it's kind of a multiple approach with not just the design as an integrated systems thinking, but the people that we work with to make this an systems integrated thinking approach. So I'll hand it back to you, Adam. Thank you.
Great, thank you, Sanka. All right, I believe we have Abraham, so let me. Abraham, can you hear us?
Yeah, I can hear you, Adam. Can you
There
hear
you
me?
are. Yes, okay, 1 second, I'm gonna put you on the screen. If you don't mind just giving a quick introduction to yourself and then, oh, sorry. Let me take these slides.
Yeah,
And
sure,
then I'll
yeah.
pop the slides after that. So go ahead with a quick introduction.
Thank you, Adam. First of all, I'm so sorry, for the technical challenge. And my name is Abraham Asmara. I'm the regional director for the Children Investment Fund Foundation, based in Addis Ababa. And in background, I'm a water resource engineer. So yeah, basically that's me in brief.
Great, thank you, Abraham. I'm going to pull up your slides and then I'll let you talk through them and I'll advance them for you. Sound good?
Thank you.
All right, 1 second. All right, take it away.
Yep. Thank you, Adam. And I will briefly, share with you about, one of the investments supported by the Children Investment Fund Foundation and being implemented by the government of Ethiopia, World Vision, and APCON, which is a private enterprise. And this is a 5-year program that brings WASH and solar electrification together. And next slide, Adam. So this project has got a prime goal of transforming the lives of millions of people and school children in Ethiopia. And as I already mentioned, it has got 2 major outcomes. The first one is the WASH outcome, and it has got also the electrification outcomes. So as part of the WASH outcomes, since it has got a focus on healthcare facilities, schools, and neighboring communities. So the first outcome is improved quality of health services in healthcare facilities. And the second one is reducing the communicable and infectious disease prevalence. And the third outcome is improving access to quality education that helps boys and girls to live their dreams. And the last one, which is also the most important part of the WASH outcome, is creating a model for demonstration of integrated transformation for a scale up. We have intentionally identified 10 districts at the different corners of the country, so that they can serve as a model for integrated service delivery transformation for the respective regions. Next slide, Adam. And as I mentioned, the second major outcome is related to solar electrification, especially, the healthcare facilities and schools, they don't have power. In the case of Ethiopia, more than 50% of the people, they still live in darkness. They don't have access to sustainable power. So the first outcome of the solar electrification is provision of quality light for emergency treatment, especially at night, including delivery. Second one is provide power to basic medical equipment for universal healthcare services, and at the same time, powering the cold chains and fridge for immunization and vaccines. And the third outcome is increasing motivation and morale of the health staff and the teachers living in the remote areas, especially in the off-grid areas, and of course, creating the mechanism to easily communicate with their families and their headquarters. And the fourth one is facilitate real-time reporting and receiving information, and consultation for sometimes emergency medical services as well. So basically, these are the two major outcomes of this particular investment. Next slide. So as I mentioned, these 10 targeted districts are in the different corners of the country, so that they can serve as a model for integrated service delivery. And the beneficiaries for this investment, we have targeted around 318 healthcare facilities, 587 schools that serves more than 500,000 students, and there are also around 17,000 around 70,000 children can be immunized in this healthcare facilities. More than 44,000 pregnant mothers can be served in the targeted healthcare facilities, and around 46,000 adolescent girls can get family planning services, and as I mentioned, 1.6 million people living in these 10 districts will have access to safe Wi-Fi services. Next slide. And this project has got as three major components. The first component, which is a very heavy infrastructure, is the water and electrification part, and the water part will be implemented by World Vision, and the electrification will be implemented by a private company called Upcon. And the second and the very important component of this project is the improved sanitation and the behavior change communication, which is going to be implemented by the government of Ethiopia with other partners. And the last and the very critical component of this project is the WASH governance. So when we say WASH governance, basically it's all about ensuring the sustainability of the project, like establishing of water utility services with clear accountability, building the capacity of the government, the private sector institutions, and at the same time setting regulatory mechanisms to ensure sustainability. Next slide.
Oops, a second.
So my last slide, this when we design this project, we have also the sustainability plan, which is a very important component of the design. And the first thing that we have as part of the sustainability plan is the professionalized utility management system establishment. We need to move from the community-based voluntary kind of management to a professionalized management model that ensures sustainability. And the second component that we planned as part of the sustainability plan is installing sensors that helps us to monitor the performance of the boreholes on a real-time basis from a central hub. And this helps us, whether the borehole, the borehole uptime per month, the mean time between the failures and repair for boreholes, the estimated daily yield per borehole, and the pumping hours, per day from a particular borehole. So basically, this is, the Water for Life investment in brief. Thank you.
Great, thank you, Ibrahim. All right, well, thank you, everyone. Hopefully you jotted down your question. I see a hand already. It's wonderful.
I just have a clarifying question. Is this what's the timeline? Is this done? Is it just getting started for this project?
For the Water for Life project?
Yeah.
Abraham, did you hear that? There was a question about the timeline for the Water for Life project.
So the timeline for the Water for Life project is a 5-year investment. But depending on the context and especially going ahead, we'll see whether we can manage it within 5 years, and yeah, we'll be flexible on that. Thank you.
And where are you at in those 5 years right now?
We just finished the first year and getting into the second year.
Great, thanks, Abraham. Yeah, this is perfect. All right. I'm going to ask a question to the group, and Abraham, I might put you on the spot real quick too, but while we're asking that, if you have questions, raise your hands and I'll bring the mic to you. Great. The one question I wanted to ask so we can expand on is, thank you. We're talking a lot about how great these projects are and how we want to integrate, but we haven't yet talked about challenges. We've touched on them, but we haven't really focused on them. So Abraham, maybe before I give you a break, can you just expand on, in your mind, what are the regulatory policy or technical challenges with trying to integrate water and energy into a combined utility?
Yeah, thank you, Adam. When it comes to especially the policy and the regulatory challenge or constraints, the first one, the policy and the regulatory provisions vary, of course, from country to country based on the existing access to power and of course to safe water supply. But as a rule of thumb, I have never seen a policy or regulatory requirement that hinders integrated water and electricity service delivery. But I believe that funding agencies and government should have a policy that encourages or prioritize or favors integrated service delivery in their funding and resource allocation, which is really key. They shouldn't be considered at the same level for a specific sector focused kind of project, and integrated project shouldn't be in a way on the same scale. So there should be a policy support that favors, that encourages integrated projects or service delivery projects. So that's from policy and the regulatory perspective. when it comes to technical constraints, the professional and sectoral based silo operation practice is one of the major challenge. And the other challenge which we usually face is considering integration as adding complexity with complete ignorance of the resource optimization for both for the initial investment, for the operation and maintenance, and the value add, ensuring sustainability. And at last, the misconception about the cost and design of the systems. We see kind of the optimization in terms of process and cost than adding complexity. So in summary, I believe that integrated service delivery is the way ahead for a holistic community transformation. For this purpose, we need to come out from our own circles and support integrated service delivery approach. Thank you, Adam. That's it.
Thank you, Abraham. All right, we have a question.
Yeah, thank you for having us to talk. I'm Jonathan Kapata from Zambia. I used to breathe the water utility in the capital city of Lusaka. And at that time, we've been saying that we should become the water and energy utility. So the issues of integration, I think it's something which is on the cards, particularly looking at the increasing costs of electricity to a level whereby as a utility, we're looking at putting up to 4 megawatts of solar power the different facilities. But just to get into the space, we started off with a small 4 kilowatts power in a peri-urban area. And we saw that it's something which improved on the reliability of water supply, because at times, even the quality of the power is very poor, particularly in these peri-urban areas. And the people don't understand when you tell them that you cannot pump water because of poor power quality, but meanwhile they can see the lights on in their houses. But if it's very low voltage, for instance, you can't find any pumps. And we saw that even the return on investment from the operation of the grid for about 2 years to get back a small 4 kilowatts. In which we put in place. Then coming to the operation and maintenance, what we saw that because as a utility we have engineers, but they do not have the specific knowledge on the solar. So we did do some capacity building for them, and it's something that's really not very difficult once we have some trained people. But also as a country to the government, they realize that they need to expand on the wash and solar pump relationship. So there's actually a program which is under design using the TVETA, the technical education support. So there with the GIZ, they're putting up a curriculum. So I think that's an area where technical people can be trained through the technical vocational. And these people can be available in the districts. So I think that's one of the ways in which the youth must get employment. Also, we can have these enterprises that can be there to maintain the systems. And also just to comment on the monitoring, yes, we had some also experience on that. We did put some servers, and this is the cloud-based IoT as in place. And actually it works very well, because even people don't have to go there to even switch on or switch off the pump. It's done remotely. And the volumes of water are pumped and so on. So we're seeing this really as it's a good initiative, definitely. And maybe just to get some more clarification on how the surrounding communities are going to benefit. I think that's one area where I wanted to get some more clarity in terms of how do you extend the supply to the communities, and that obviously is also a revenue generating. Yeah, because I don't think it would be good to have a school, a clinic, just with power and water, but the surrounding communities don't have the facilities. So definitely that aspect is also important. Thank you.
Yeah, thank you so much. I'd love to talk to you more after and learn your experience. That's really great. I'm just going to touch really quickly on your last question, and then if anyone else on the panel wants to comment as well. The way we've been thinking about our approach to this delivery, integrated delivery, is looking at health institutions and schools as an anchor load or a primary load. So we know we have a big power demand, we know we can set up a system, but as you rightly mentioned, we have to consider the whole community. And so getting that anchor load in place is important, but then looking at, like Mason and Fatu can expand on the public kiosk concept, but then also thinking about direct household connections, depending on density of the population and if it makes sense within the community. So that's kind of how we've been thinking conceptually about it. But anyone else want to expand or add on that?
Adam, I think I can. I just want to, the audio is not super great, unfortunately, coming out of the room. So I just want to make sure that I understand the question correctly.
The question was, if we're focusing on healthcare facilities, what about the surrounding communities? How will they benefit from this integrated service?
Yeah, that's a big part of the Health Grid Sierra Leone model, is trying to identify those in community local partnerships with either local businesses or even individuals, local entrepreneurs who can leverage. So again, sort of the primary intervention, the intervention point is, in our case, health facilities. So our goal is to provide the health facility with the electricity, the internet connectivity, and the water that it needs free of charge, because they're providing that public benefit, but also somehow generate enough revenue to keep those systems operating long term. And where we see the revenue coming from, but also the additional benefit. So the other productive use cases coming from those private partnerships in the community. So for example, we're exploring a relationship with a company that does like a battery swap program. So they charge batteries and then rent them to people in the community to charge personal devices. And so an arrangement could look like this company uses Health Grid PV systems to charge one of their battery charging stations. They just do their regular operations. One that brings them into the community, right? With a little bit of the CapEx for their business model, and then allows them to bring their product, so in this case batteries, to that community. And in exchange, we're working out a revenue sharing arrangement. So a small percentage, and I think one thing to just emphasize is that the O&M, at least in our estimates for these systems, so we're talking about PV systems or wash systems, is not a huge amount of money. So it's a small percentage of the CapEx cost, maybe something like 5% annually. So we're talking about, in the hundreds of dollars, not thousands or a big amount of money per year to do this O&M. So it's not an insurmountable cost. So from revenue sharing, things like the battery exchange program, or if you did sale of water to the community, and just took a small percent, like maybe it's 1%, maybe it's even less than that, we feel like that those revenues could go a long way in covering the operations and maintenance costs for the PV systems, while also providing an additional productive use and an additional service to the community beyond the health center.
Great, thanks, Mason. Anyone else want to add anything?
Yeah, Adam, I can just add a few things. One of the things that we considered when we designed the Water for Life program is having both, the institutions and the community. As I mentioned, there are around, 733 institutions. When I say institutions, schools and healthcare facilities. At the same time, there are 1.6 million people, living, around these institutions, and both of them are, targeted, through this program, and they will benefit from this program. When we try to isolate and provide service only for the schools or, for the healthcare facilities, it's really expensive, and the cost per capita would be really high. But when we bring in the community and the institutions together, we can also optimize cost, and that's how we design this program as well. Thank you.
Thanks, Abraham. Any other comments, Fatu or Sonika? Nothing. Okay. Any other questions for now? I can move on to another question I have. Peter has a question.
Thank you. Thank you all for all the work you've done in thinking through the integration of water and electricity. My question is two parts. One is, have you found that the water folks and the electricity folks speak a similar language and understand one another, or you have to done a lot of translating to get things to work smoothly? And my other question is, often if we're doing just a water specific program, that would have a behavior change component that comes around it. Do you envision any behavior change necessary for community members as we introduce electricity into communities that could partner with a water behavior change model?
Great. Thanks, Peter.
Can I build on Peter's first question?
Sure.
Sorry, so building on Peter's first question about the similar language, I was also wondering if they're like from the water side versus the power side, is there one group that seems more excited about this partnership, or is it pretty equal? I'm just curious.
Okay, great. Thank you, Justine. So, panelists, did you hear those questions? You did. Okay. So the first one, in case anyone didn't, was about translating, sharing a common knowledge between the water side of this and the energy side of this. How has that been for you? And then, well, I guess we'll pause on the second question. And then Justine, you asked within those two groups, which seems more excited about integrating this approach. So anyone want to take that?
I mean, I'm happy to start. I think that there are, just some technical communication gaps, or like, some places where certainly if you know a lot about, like, especially the technical aspects of putting in a water pump or building a water tower or moving water around a community, that's just a different expertise from electrical engineering or putting in a PV system. I've found, so, there may sometimes be those communication barriers, but I've found that it's like, the process doesn't really require everyone to kind of understand the full system of each piece. Like, certainly I think that working with World Vision, they have a good understanding of PV systems, and because they do a lot of projects where they do the full thing, right? So in Health Grid Sierra Leone's case, one partner is doing the PV system and another partner is doing the wash system. But I know that in some cases, World Vision just takes on that whole piece. The one thing I will say where there is definitely commonality and there's definitely common understanding is on this problem of O&M. We hear it both from folks, who are in the energy provision side and in the water side, of just this continual challenge of donors and aid agencies, right, are keen, they're eager, they're happy to do the CapEx, like, okay, we put in a system, we can do a press release, look, it's working now. And then we kind of wash our hands and we walk away. But then over time, that equipment breaks down. There's no mechanism put in place to keep it going, to do that routine maintenance, because that's not the exciting, not the sexy part of it. But what you end up with a year later, a couple of years later, 5 years later, is just sort of junk in the communities, right? Because and it's that key word of reliable power, reliable water. Unless you have those mechanisms in place, keep them moving, it is not reliable and it's not a long-term solution. So that is definitely a sort of shared challenge and a common, like just a, something that both sectors readily get and have experience with.
Thanks, Mason. Fatu, do you have any thoughts about this from your experience in Sierra Leone?
Yes, I'd like to just mention, because maybe during the presentation, of course, I didn't have the opportunity to explain that, but I think this would be useful to share about the partnership model we are currently trying to make sure that is driven by the Ministry of Health with the community, and for ownership. Because as the project is we're waiting for installation to start, we've been very systematic in the way we ensure that the Ministry of Health leads the process to get the community sensitized about the project and what is to expect, not only in terms of, the intervention, but also about the sustainability aspect. I think that's going to be a very sound kind of lessons learned when we pull our experience together about the way we have systematically worked with the Ministry of Health to make sure that the community is involved, the community currently knows about what the project is all about, what to expect, what the sustainability thinking is of. So at the end of the day, I believe for the person who mentioned about partnerships, I think that's a very good angle that we should drill down and later on explain our experiences and our lessons learned.
Great, thanks, Fatu. For the sake of time, we'll jump to the second question, which was about behavior change. I'm curious to hear the answer to this question as well, but has anyone given thought to, or how, Abraham, you mentioned governance, Sonika, you talked about kind of the community engagement process in your case studies, and I know there's similar things going on with Resolve, and Fatu just mentioned kind of thinking about sustainability and partnership. But has the term or the idea of behavior change come up? Fatu, your hand is raised, so please go ahead. Oh,
I could touch on this point too.
yeah, go ahead, sure.
Yeah, so for the behavior change, the second case study that I gave with the nature-based systems in India, and colleague Abraham also touched upon this too, and one member of the audience, it does, when you have an easy out, I would say, and folks are just already utilizing their, right there in the canal, they were just disposing their waste into it because they're low income areas, it was convenient, and flooding was occurring and taking those waters into those homes. There is this behavior change that needs to happen. One thing that we did, we partnered with a local organization as well, that's a subject matter expert on nature-based solutions as well, to try to change this behavior of managing waste. So that was one thing. And secondary too, I learned in that particular area, the youth is very promising. Like when their children talk to their parents about what they learned in school and how this is not good for the environment, that really helped frame some of the, I would say, the adults in the room and their mindset of what we're supposed to do as well. So with the community cleanup, I guess, and behavior change, I really have a strong emphasis on educating the youth and working with the community, because they're also going to influence the adults around to have more environmentally friendly behavior. So with the nonprofit that we're partnered with in India, we're just conducting workshops. First, we did surveys to understand what their supply and demand was, how much capacity the community is currently managing, to be able to understand how can we frame this for that future scale to get to.
Great, thanks, Hanukkah. In my experience, thinking about electricity with behavior change, I haven't seen anything specifically around behavior change, but what I have seen is a discussion around making sure that, you know, healthcare facilities, schools, and any other important services continue to have the electricity, so that if you put in a system, you don't have the community using all of the electricity. And so one way to get around that is to actually put in a control, so that, you know, you can actually meter who gets electricity at what time. So that's not really behavior change, although I guess in a sense it is, but it's a more technical approach to behavior change. But I do think there's a need, and so I think I'm going to move on. But I do think there's a need to further this discussion about, you know, the use of electricity. I think it seems kind of intuitive, but it can be challenging when you're introducing electricity to an area that previously has had none or not reliable electricity. And so I think that's a really good question that I haven't seen explored very much so far. 2 questions.
I was wondering if the power at the hospitals is used for like incineration of waste, or if you're specifying what the power is used for, or just the hospital administrator gets to decide, and how, if you are specifying, how you're deciding what should be, you know, prioritized on that list.
Yeah, it's a good question. I know in a few examples for World Vision, we've gone to the healthcare facilities to understand what are the power demands and what could the power demands be. And so we kind of let them make those decisions and then design the system around that. But I'm curious if anyone else has had experience with what the electricity is being used for at the healthcare facilities and how that process was implemented to determine those loads.
Well, I can chip in, Adam. Basically, you know, when we design the power system, especially, you know, for the institutions, the first thing that we did was calculating the power demand. For example, you know, what are, you know, the different, you know, equipment that you know, use, you know, power at the health post, at the health center, you know, at you know, a primary hospital. So these are some of the considerations, and we did, you know, the power demand calculation. So based on the power demand, then that helped us, you know, to design you know, the number of solar panels and, you know, all the inverter capacity and, you know, everything required, you know, to address that demand. So basically, you know, that's the procedure that we followed. And as it has been already mentioned, you know, since we can't have the different kind of, you know, power for each institution, we somehow standardized in different categories. And the other thing that we did, especially in a few areas, we found the schools and healthcare facilities, you know, co-located, and we provided, you know, power both, you know, for the school, healthcare facilities, and other institutions, plus, you know, the neighboring community from one power source. So that's the kind of, you know, design that we used, And this helps us, to ensure the sustainability of the system as well. They can safeguard the system, and they can, of course, pay for the system and ensure sustainability.
Great. Thanks, Abraham. I'm going to move on to our last question, just for the sake of time. Christy, go ahead.
It's the last question, but okay, just kind of, yes.
Second to last,
I was kind of related to the behavior change question. I'm curious if there are any, if there's anybody who's looked at, or if you're considering looking at the gender impacts of access to energy. I'm thinking about access to technology, access to mobile phones. Do you see, is there any existing learning or any ways you're planning to learn about whether that might have an impact on women's access to technology, whether positive or negative?
Yeah, that's a really great question. Does anyone want to respond to that? Any takers?
Adam, could you please repeat, the question? There was an echo.
I think the question was about looking at gender equity and women's access to electricity, whether there's any studies that have been done in terms of how we're thinking about promoting gender equity when we're thinking about integration of water and electricity.
Yeah, I think particularly, you're including internet access, mobile phones.
Yeah, mobile, yeah.
Not the ones with phones. So, see a potential impact.
Yeah, so we're looking at mobile phone charging and internet, and often women don't have access to those services. So has anyone looked into that? Are there any studies out there? Or what are we thinking about that for this project or this approach?
I can jump in, but also maybe sidestep the question. I don't. In terms of the internet connectivity and mobile access for women, we haven't looked at least that kind of particular dynamic of it. But I was kind of connecting it to the previous question about the types of services, like the priority services at health facilities. In Health Grid Sierra Leone's case, again, we're targeting very small, rural, remote health facilities. And so the kinds of things that we're like the priority things to power are very kind of basic services, the pumping of water to key points of care, things like lights and fans for temperature control and to keep insects away. We are, of course, in the middle of a pandemic, so powering cold storage sites for vaccines is a priority. But the other key thing is birthing and maternal health care equipment, where we're prioritizing. And so in that way, which we know there's is a issue in sort of maternal health outcomes broadly. But that is like among sort of the key services and the key indicators that we're looking at in our project is how, one, powering the equipment for deliveries, and two, that then affect who's actually seeking out, who's actually going to clinics to give birth, right? If you go to a clinic or to go to a facility and have a poor experience, so there's not water, there's not electricity, doesn't really encourage that to keep happening. But if you have a positive experience, then maybe you actually increase the number of people who seek out, who actually go to the clinic to give birth.
Thanks, Mason. Any final thought?
I could add on to that a little bit too, and I hate to answer a question with another question, but the question that usually comes to mind with gender equity in areas is, are there, at least specific to internet, is there a lot of women-owned businesses, entrepreneurs, like women that are advancing in society the way that we would like to see the equity for women available if they do have access to internet? So I think if there is a lack of data set or data available of like women-owned businesses, I think that speaks for itself. So that would have been my question. If there is no perhaps data there, perhaps it's not right there. So I think the potential is really there to allow women to have that access to internet, to advance them and progress them from their other duties that they might be currently fulfilling to something potentially more.
Great, thanks, Sonika. Christy, we should talk more about integrating Jesse with this approach too. Question, final question.
Thanks very much for the interesting subject. I understand that the installation of both solar power and electrical facilities is not a new thing. Some facilities already have maybe solar power, but maybe not really integrating with the wash as we are talking about here. Maybe one thing maybe we want to consider is going back and see what has been the success like and the challenges to the installation of the solar power in the electrical facilities. Because I know that like in Malawi, a number of facilities that were provided with solar power are not solar power is not functioning. Issues of sustainability. And I was reading a certain report which was talking about the capacity building of the Ministry of Health to sustain the solar power in the electrical facilities, more especially looking at the human capacity to maintain such facilities, but also lack of proper maybe materials or supplies to facilitate the proper maintenance of this facility. So maybe in this project, it's very important to look back and see the projects that have tried to install solar power in the facilities and see what has been the challenges and what has been the suggestions so that those can be lessons as we move forward in the initiative. Thank you.
Yeah, it's a really great point. And I'll just add that World Vision has done some solar electrification. We have been looking into that, and there are some mixed results into the sustainability. One thing that we've touched on, I think all, is really looking at that governance piece. And one of the advantages of combining Washington Energy, in our opinion, is that seeing it as a service delivery, as a micro utility, you're kind of putting the ownership on either a government or a private operator. So hopefully that would improve the reliability. But then there's the funding question about how do we maintain that financial sustainability. So it's a really great point. Thank you for that. All right, well, we do have one question online, and in true fashion, we won't get to do any of the fun things I had planned because we're over time. But so the question for panelists, this is going to kind of queue up any final thoughts for the room because we have 3 minutes. But the question was, what is the process for this program to benefit a marginalized community in my city? I don't think we have time to fully answer that question right now, but I think it does raise a question of what are the barriers to funding this type of work, and what are kind of the next steps that you're all thinking about that we take to further this approach and get it spread beyond the projects that we're talking about here. So Fatu, do you want to give maybe a 30-second overview before we wrap up?
Oh, okay. I think next steps from the health grid perspective, we are kind of looking forward now to actually farm up our monitoring and evaluation and learning framework. And actually, I have to say that the presentation given by Abraham to me was very informative, and I think it will also inform our MEL, because we will be collecting data on more or less the same indicators and some of the indicators that we had not thought about. Abraham's presentation is giving us some food for thought. So I think for me, that's the next step I'm thinking of. It'll be like as early as next week, and good to mention that World Vision is leading our process now.
Great, thanks, Fatu. Sonika, any final thoughts?
Yeah, so when we look at infrastructure in totality, our impact infrastructure, I'm going back to that second example for nature-based solutions. Ironically, we saw the breakdown of budget and assets that are available in the community, and there's 10 times more canals in the community than there was assets for waste management. So we could already see budget wise that silos, that separation of budget, and being able to get those integrated key stakeholders and partners communicating each other for that final cost benefit. So we are conducting a cost benefit analysis next of the area to really understand how can we integrate infrastructure even and break down those silos of government budgets as well to be able to have better access for everyone. So Bechtel.org, we are keening in on innovation and through impact infrastructure. So if there's any journey you'd like to go along with us or any conversations on creative and innovative solutions, even beyond WASH and solar through impact infrastructure, feel free to reach out to .org.
Thanks, Annika. I know we're at time. I'm going to put this slide up. If anyone does have to leave, please use this QR code if you would like to reach out to further the discussion. But I will give Mason and Abraham just a minute to respond as well if you have time. So Mason, please go ahead.
Yeah, for us, again, this question of next steps, I think in Health Grid Sierra Leone's case, it's proving the model and then scaling it. And so we do, we are just in the process of setting up the first installations and the first arrangements in Sierra Leone. And we need to prove that sort of our theory of money and our theory of O&M is actually sustainable. And then if and as we do that, moving to more health facilities and also potentially moving into more sectors. I'm intrigued by the example Abraham shared of also doing this in schools, and you could imagine expanding to other anchor institutions as well. So thank you all for joining us today.
Thank you, Mason. Abraham, any final thoughts?
Yeah, thank you. As if, we believe that our, challenges are getting more complex than before. Our previous practices can't, anymore fully address this, complex challenge. It demands, operational efficiency, optimizing resource and process, and innovative, service delivery approach that responds to, to the complexity. And we believe that, funders and government should, come up with a policy that, prioritize integrated service delivery models. Thank you. Thank you, everyone.
Great. Thank you so much, Abraham. Thank you all for joining. Please come up, talk to me after if you have other questions, but enjoy the rest of the conference. Thanks.
Thank you.
Everyone. Thank you.
Thank you.
Thank you.
Thank you.
Bye.
Stay on.
Talk to it, Abraham. You have a minute. Talk to it, Abraham.
That's okay.
Oh,
Oh.
you're still there?
Will you leave now? It's end.
You have a question for Fatu?
Well, I think that we could just let's see it's so hard to set meetings. If everybody's on right now, we could just like 30 minutes and just like all the sensors. We can set it.
We
We can set it. Hoping
they've been pretty.
Yeah.
We can pretty.
Okay. So I have your email. You have their emails or should my email? There you go. Yeah, we do. Are you gonna make it happen? Hey, well, super exciting and lots of ideas. And so it sounds like it's very only. And we're talking to links in our local.
I don't have questions for you, but I'll just.
Yeah, so Mason is trying to resolve water there and they're part of the whole grid. That's why that's the issue.
And so like, who's doing something? I understand that Mal is slightly different than like research. So it's not Fatu and is in charge of Mal, or she's like, well, she's like, well, Edmonton's in charge of Mal. I don't mind.
So
if we want to like boost up the research side.
I wanted to say hello. Jonathan. Okay. Yeah. So I did my PhD with ciders. So working on periodic sanitation and how many pumps. So I spent quite a long time sitting there and actually interfacing with them. So I don't have a big ask or a big, more of it just wanted to say, I really appreciate your comments. That's really interesting to hear. Where this has been tried before. That's always the problem when people are trying things. They've been tried other places. So it's a little clear now. I think I'll be back in December. I'll have to take like